Hello and welcome to another episode of Ecosphere on TV 360 Nigeria with me, Fidelia Aguncha. About 71% of the Earth's surface is covered with water, but despite this, millions of people do not have access to this basic amenity. Research has shown that more than 780 million people worldwide do not have access to an improved water source. Nigeria makes up more than 10% of this figure, and the government has indeed admitted that there is a crisis in the country's water sector. The country's Minister of Water Resources, Suleiman Adamu, says about 71% of Nigerians do not have access to potable water, while UNICEF in its report says more than 90% of households in the country consume contaminated water and other impure substances. On this episode, we will beam our light on Nigeria's water, sanitation and hygiene sector, WASH. Water, they say, is life. This basic amenity is arguably the most important for human existence, as it is almost impossible to go a day without water. For a healthy body, one must drink water. For a clean environment, water is essential. Water is also very vital in checking the spread of diseases with the practice of hand sanitation, and the list goes on. In the past 8 years, Nigeria's Ministry of Water Resources has allocated over 115 billion naira for the provision of water across the country. But despite this, access to pipe-borne water has dropped from 32% in 1990 to 7% in 2015, with over 69 million people lacking access to clean water. In fact, latest data from the government shows that financial allocation to the WASH sector, that is water, sanitation and hygiene, has declined from 0.70% of the GDP in 1990 to about 0.27% in 2015. This grim statistics has forced President Muhammadu Buhari to declare a state of emergency in the water sector, launching an action plan to revitalize it.
Distinguished ladies and gentlemen, it is now my honor and privilege to launch the National Action Plan for Revitalization of Water Supply, Sanitation sector of our country. It is also my singular honor to formally declare a state of emergency on Nigeria's water supply, sanitation and hygiene sector. Henceforth, federal government support to state governments will be based on their commitment to implement the national water supply, sanitation and action plan in their respective states, and to end open defecation by 2025.
62 million Nigerians were yet to meet the MDG water supply indicators. This is the water supply situation. But if we go by the Sustainable Development Target, which is that we must have improved access to water supply located on premises, available when needed, and free from fecal and chemical contamination, we'll see that 185 million Nigerians are off that target now, at present.
Nigeria is looking to achieve its Sustainable Development Goals target for WASH by 2030. This means the country must provide water, sanitation and hygiene services in adequate quantity and quality at affordable prices. But with the current statistics at hand, this vision seems bleak. In many states across the country, access to clean water has become a Herculean task. It is primarily the responsibility of the local and state government to provide WASH services in their locality, but recent statistics shows that most of them have failed in this task. In northwestern Katsina State, this stream is the major water source for people in Jibia community. Activities ranging from washing and bathing, among others, is carried out here, after which the water is collected for cooking and drinking. Elsewhere in Nigeria's capital city, Abuja, where the situation seems a bit better. Access to water is no longer a right, but has become a privilege to locals in this community. This resident of Center 1 Abaji Area Council in Abuja says they are only given access to water once a week by authorities.
They are giving us water now once in a week. Once in a week, we are not enjoying the water because water is our life.
Even Nigeria's commercial nerve, Lagos, is not left out. A resident also shares his current situation with us.
When we talk about water, water is life, you understand? And when we're talking about water, everybody must have access to water, sometimes. But looking at my environment, I will start an example for you now. My environment, we don't have water. I used to stay in Abuja before I relocated to another side too. We don't have water, so you get. And anybody that has water in his environment is like a king. But the thing is to be sincere, it's not a nice thing. But in the job today, 21st century, we are supposed to have water. So you get. Water should be the least that we should be fighting about today.
In this ravaging crisis, waterborne diseases like diarrhea, cholera, typhoid and others have posed serious health threats to many Nigerians, with children being the most affected. Preventable deaths have been recorded in thousands, with aid body WaterAid stating that no fewer than 60,000 Nigerian children below the age of 5 die of diarrhea every year as a result of poor hygiene and lack of access to clean water. Diarrhea is the second leading cause of death in children under the age of 5 across the world. Research has shown that washing the hands with soap and water after defecation reduces cases of diarrhea by almost 50%, but it is difficult for 81% of the world population to practice this life-saving action due to water scarcity and a host of other challenges. Environmentalist YUSUF Kilani shares his thoughts on the possible causes of this crisis.
There's no one that can live without water, and everything we do, our daily lives, is with water. And what it means is that it has to be clean, it has to be hygienic enough. We drink it, we bath with it, we wash with it, we do so many things with it. Now, part of the findings from a report that was released about 7 years ago is that we are having a lot of human activities, intentional and unintentional, that tends to increase the poisonous level of underground water. Yeah, the water, they are all linked. If I mount my borehole here, the same water that I'm gonna tap from is the same water that someone elsewhere about 100 kilometers away is that same water. And so when we have any poisonous activities going on there, it affects same water. Okay? And there are a lot of people, so sad enough that even here, people have linked their sewage system into the underground water system. There are a lot of pit, latrines that have been linked. There are a lot of waste, waste areas. And, when you have long-term waste, that's when we have what we call this methane. And methane is a very poisonous gas and very, very harmful to the environment. And when they find their way into the soil and into the water system, it's a lot more poisonous. Imagine a city like Lagos, where everybody, when I mean everybody that owns an apartment wants to have his own water, and they begin to mount borehole. So we are talking of about a minimum of about 1,500 boreholes constructed daily in Lagos. Now, you multiply that by 30 and 365, then you get to understand the damage that we bring about. You understand the effect on the underground water systems, and that is the reason why the Lagos State Water Corporation tends to bring about a legislation that will stop people from mounting boreholes, because these boreholes are not guided. There are a lot of boreholes that have been mounted and abandoned, and people have turned them into pit latrine. A whole lot of them from survey, and this thing affects the underground water system, and which is harmful and not hygienic enough.
At the launch of the action plan to revitalize Nigeria's water sector, President Muhammadu Buhari noted that wash services at the rural areas are unsustainable as 46% of all water schemes are non-functional. He urged state and local governments to do more to address the situation, as federal government intervention to states onward would be determined by their commitments to meeting the country's Sustainable Development Goal 6 for water and sanitation. Other stakeholders, while agreeing with the federal government, say for the revitalization of the wash sector, all hands must be on deck, starting from the grassroots.
The action plan that has been launched by Mr. President today is not just a federal action plan, it is a national action plan. An action plan that was developed not only by federal government, but by state government's participation. Just like you heard, it's an action plan that emanated from the system. When we saw the statistics and we saw the problem that we had, bearing in mind that the access to water supply sanitation is declining everywhere, it was taken to the National Council of Water Resources, where a decision was made that we need to work together, the state and the federal government, local government, to develop a national action plan that will renew the partnership between federal, state, local government to collaborate, to work more, and also to put in development partners' efforts together towards increasing and improving access to water supply, sanitation, and hygiene in Nigeria.
There is a lot that needs to be done. We need to make sure that, all the government, both from the federal government, the state and the local government, that everybody is on board. But not just that, we also need to have civil society, the media, and people at the grassroots level. I mean, if we're in a war situation, the media will report what's happening every single day. That's the way we need to look at the situation with water and sanitation. It's a catastrophe. It's a crisis. We only 34% of Nigerians have access to toilets. A lot of us, over 100 million people, are openly defecating. This is a crisis, and I think that the government has done what it needs to do, to declare a state of emergency and to make sure that everybody recognizes that all hands have to be on deck, including the media.
Aside sensitizing residents on the role they can play in addressing this crisis, Kilani says adequate plan for water flow and proper drainage system is also very essential in mitigating this disaster, adding that more responsibilities lie on the shoulder of the government.
Now, one of the things we need to do is to create awareness for the people to understand these things. That little things that you actually don't count can go a long way in destroying so many things. That's one, we need to maintain our boreholes. It links to the same water. The same water I'm taking down there is the same water someone in Aja or someone in Badagry or Alagbado is taking. And so we need to take very good care. Then two is that the drainage system in the land. And from what is evident and what we have in Lagos today, it is not interesting at all. It is totally against what we should have in a civilized system, where we have a whole lot of sand filling on the sea, and yet the drainage system on the land is not being visited. What it means is that the wetlands are supposed to be retention areas for water, because whenever we have this huge rainfall, they go into the sea. That's the style of Lagos. They wash down into the sea. But at times, you have the water system too could be on the high level where it cannot contain more water. So the wetlands are areas that retains water for a while, and they are areas for green animals, plants and the likes. After a while, when the water level reduces, the water from retained in the wetlands will now flow into the water. But right now we have a system where the government is just filling these wetlands. Do you know that the entire Oworonshoki end, Oworonshoki, K2, all that area are all wetlands? They were not meant for developmental purposes at all. And they are green areas, wetlands, all over the world. When you go anywhere in the world, these areas have been there for 40, 60 years. They remain a park, they remain wetlands, because they have what they do to the environment. But we don't seem to have a regulation here. We do whatever we like. People now go there, they sandfill, they build structures and what have you. And so when we have huge volume of rainfall, where is the retention point? We don't have them any longer. So that's why the water will come into our homes, because we do not have adequate plan for water flow. The local government needs to take responsibility of providing pipe-borne water to every residential apartment. But one thing the government needs to understand is communication, because that was their plan when they said they are going to ban the construction of borehole, but the communication was a bit poor. People need to understand the pros and cons, and they need to understand the effect of these things, you know. And when you have a system where you monitor boreholes being constructed and major channels where you have water flow, you'll be able to monitor so many things. For example, look at the bottled water we take. I can tell you for free, 98% of the bottled water we take are infiltrated water. They are not hygienic for consumption. The Lagos State Water Corporation, in conjunction with NAFDA, they carried out a test 2 years ago, and they found out that we have over 122 registered water companies that produces bottled water, and about 98% of them failed their water test. They conducted a water test and they failed, because many of these guys, they have just borehole, you know, they don't treat this water very well, and they sell this water to us and we drink. And you cannot doubt their data, because if you go to the hospitals, more of the kind of illness we have is waterborne related. You know, you have dysentery, you have typhoid, you have malaria, water related. You know, and that is the reason why they declared that emergency. But then, declaration will not just do. We need to communicate effectively well with people to understand the concept and what we are talking about and the reason for that. So the local government needs to take responsibility, in the sense that it is their responsibility to provide water. Basic, and water is basic amenity of life. You can't survive without it. So they have to provide it. And it's not this junction, they go and do one pipe boy water and one politician will just write, yes, I've done this community project. It's nonsense. We are talking of accessible, clean, hygienic water in my house. So it's the responsibility of the local government. And the local government, have to take, like I said, have to take that responsibility, because by the Constitution of the Federal Republic of Nigeria, which we operate, these are responsibility of the state, domiciled in the hands of the local government. You know, just like we have education, primary school, the local government takes care of the primary school and the likes. Even housing is state matter. Water provision for my homes is state matter, domiciled now under the local government. Refuse management, to take my refuse, is in the hands of the local government. So the local government needs to take responsibility.
A research by the United Nations Development Programme UNDP shows that 2.1 billion people in the world have gained access to improved water sanitation since 1990. The adoption of rights to water by 41 countries globally within their national constitution is likely responsible for this growth. Though Nigeria is not among the 15 African countries party to this movement, but with the commitment of the present administration in improving the wash sector, accessibility to potable water is likely to improve across the country. An estimated 2.5 billion people globally lack access to improved sanitation, with research showing that about 1.1 billion of them practice open defecation. Nigeria is one of the most affected in this issue, ranking second in open defecation worldwide and top in Africa. When nature calls, one just has to answer, maybe not immediately, but eventually. In a country where more people have access to mobile phones than toilets, answering this call becomes a huge challenge. Statistics shows that about 47 million Nigerians practice open defecation, with data from UNICEF showing that only 3 of the 774 local government areas in the country are open defecation free. This is why it is common to find human feces and stanching odor of urine in open spaces, even in the best cities across the country. But what really is responsible for this negative trend? A cross-section of Nigerians are of the opinion that open defecation is on the rise, owing to unavailability of toilets, illiteracy, and poor upbringing.
The reason is just simple. We don't always see around us public toilets easily. There are people who can access. Anyone you see around, you see, they'll just tell you to pay some amount of money. Okay, in Nigeria, people that doesn't even have money to even feed in the first place will now want to defecate or something, not to notice themselves. To eat themselves is something now.
I think the issue of defecating everywhere starts from the family. Like I said earlier, family. You know, there's some things, if you don't get it right from in the family, the society can't be a good place. Do you understand? So, you know, before you can have a country, it starts from family. Cleanliness is next to godliness. If there's no toilets, olden days, you know, in the 60s, I'm not sure there was a WC in Africa then. Do you understand? But there's a way they do it that you can't see it everywhere. Do you understand? There's a way, no, people go to farm now. Are you telling me now that people, the farmers don't defecate in the farm? No, they open the ground, they do the thing, then cover it up.
8 years ago, there was a debate that Lagos is not amongst the 10 most developed cities in Africa. And Lagosians argued. And while looking into the study, one of the things discovered was that a lot more Lagosians in Lagos, a lot more residential homes do not have water closet. You know, the water closet system, you know. A lot more people still make use of pit latrine, which is so awful and a disaster to us as a city. You know, and everything will still come through government legislation, where when you construct, there's a standard. There are things that must be put in there. Quite unfortunately, we travel to other countries and we see the way things are being done. For you to have your certification and clearance for you to carry out a project or a construction site, you must put into consideration safety, access to escape anytime there's any disaster. Water must be, there must be a plan of water flow everywhere. You understand? Your toilet, it's very, very important you have a very hygienic, you know, standard, you know, toilet system. I think we need to replicate same thing here. It should be a standard. For example, what will it cost if they say, okay, the entire, you map them out in Lagos, Ikeja, for example, all residential houses in Ikeja in the next 1 year or 6 months, you want to eradicate the pit latrine system, and you do that across board. Once you do that, too, the open defecation. Why do we have open defecation? How many public toilets do we have? And people eat every day, and they have to pass out every day. When you have input, there must be output. So where are the toilets? We need a lot more public toilets.
Improved sanitation and hygiene practices are fundamental, not just for healthy living, but also for socio-economic development. The 2018 National Outcome Routine Mapping Report indicates that Nigeria loses 455 billion naira annually due to poor sanitation, while further research by the UN shows that no fewer than 122,000 Nigerians, including 87,000 children under the age of 5, die each year from diarrhea, and nearly 90% of this is directly attributed to lack of water, sanitation, and hygiene. Nigeria's Minister of Water Resources, Suleiman Adamu, has warned that if necessary actions are not taken by relevant stakeholders, Nigeria may move up, overtaking India as the country with the highest number of people practicing open defecation. But how do we address this human disaster?
Now, maybe the government should just come in by educating parents more. You know, use the avenue of school, social gathering, you know, churches, mosques, and then, you know, burial and all these ceremonies. They just use those avenues, pass the message across to them. This is what you need to do. This is how you need to train your child. You know, like where I came from, I'm a Yoruba. You know, the charity begins at home. Meaning, do you understand? It is how you train your child. Then you can beat your chest that you have secured a better tomorrow when you train your child very well.
Illiteracy. Then I think people need to be given awareness and to be taught and told that the effects it will be on them by doing open defecation. By building public toilets so that people can go there and do whatever they want.
Sanitation, hygiene, likewise education, they are responsibilities of the state. And what the government needs to do is to encourage the state to vote a certain percent of their state budget to be dedicated to this, water, hygiene, and environment. Okay, that needs to be done. Now, intervention that comes from outside, of course, they come to the federal government, to the states. They collaborate with the states in trying to tackle these challenges. Okay, so that's what they need to do. So it is for the states now. So I'm trying to say that it's not the federal government that will increase its allocation, because the federal government do not make expenses in that. If they have been doing it, is wrong. But at times it comes in as a kind of like intervention. And states needs to be encouraged to increase their budgets in those areas, so that the local government now, who are those who carry out this project, like in those days, we used to call this, we have at the local government level, we have the environment officers. They call them wule wule. They are the ones that go to every nooks and crannies, you understand, of the community, you understand, to find out these things. You know, how hygienic your environment is. For example, if you have a building and you have an open sewage system, you'll be fined and you'll be asked to put it in place. So that money, that funds to do all that comes from the state. So the state should be able to do more.
Nigeria has a goal to end open defecation by 2025. To achieve this, the federal government, alongside its action plan to revitalize the water sector, has launched an open defecation-free campaign roadmap, which aims at constructing about 20 million household toilets and 43,000 toilets in schools, healthcare, and public places. And that's where we draw the curtains on today's episode. But remember, a healthy environment begins with you and I. Till we meet again on Ecosphere, it's bye for now.